In your practice, what are some of the most frequent disease processes, complaints that you encounter in both men and women?
I see so many men and women for sexual dysfunction. So when I see men for sexual dysfunction, I see a lot of men for erectile dysfunction, right? So that's a very common condition
And
as
how
well.
would that be defined?
So it's inability to obtain or maintain an erection, right? So inability to obtain or maintain. That's the easiest way to define it. Some men can obtain the erection, they can't maintain the erection, right? And the statistics are very similar to when I told you about low testosterone. 50% of men over the age of 50, 60% over 60, same numbers. It's amazing how many men suffer from this condition and we don't talk about it, right? So erectile dysfunction is a very common condition. Premature ejaculation, right? So, 30% of men will suffer from some degree of premature ejaculation, which can be very bothersome to the relationship. The average man will ejaculate within 7 minutes. Premature ejaculation, most men will ejaculate less than 1 minute, right? And there's a discrepancy, so it's very important to realize that men and women, premature ejaculation can have a big impact on their relationship. How about Peyronie's disease? 7 to 9% of men suffer from this.
And what is the cause of that?
So I believe that so as men get older and as they start developing a mild erectile dysfunction, they start increasing the risk of having a buckling incident during sex. So let me give you an example. If a man has a 100% rigid penis, he's fine. He's not going to injure himself. If he has a 50% rigid penis, he's not going to be able to penetrate in the first place. But he's in trouble when he has a 90%, 80%, 70% rigid penis, because what's going to happen is he's going to penetrate and he's going to buckle and injure the penile tissue. And when he injures the penile tissue, what happens is you develop a scar.